Everybody for coming. This is September 12th, 2022, and we were meeting for Panhandle Health District update. It's 11 a.m. and calling this meeting to order. In attendance are Commissioners Brooks and Duncan. Are there any changes to the agenda? Okay, hearing none. Our first discussion item is the quarterly update with Panhandle Health District Director Don Duffy, and I see that you have Eric Kettner here as well.
Eric's here. Any other further questions, particularly environmental side? He's certainly our subject matter.
You need to turn on the microphone.
Oh, there we go.
There you go.
So yeah, I brought Mr. Kettner with us. He's certainly our subject matter expert, all things environmental. So I thought if you had some questions, I'd asked him to be with us. But just a couple of things I wanted to, again, thank you again for the county ordinance on the 5-acre rule. That's been something that has concerned us greatly over the last year. And as I know you feel and we all feel, this unseen jewel of the aquifer, we're so grateful that that continues to be protected going forward. So I want to thank you on that.
Could you explain, before we were on the record, we talked a little bit about that because I was confused and I had a constituent who had some good questions. He said, I thought Panhandle handled that. Why are you doing it?
Yes.
And what was your explanation?
Thank you. Well, we essentially lost the authority, but I think Eric's explanation, if I could ask him again, Commissioner, to rephrase those or repeat what he said to us earlier, I think that brings even additional clarity.
Sure, and just background, it has been, the Panhandle Health District has had an Idaho Administrative Code rule since 1978. It was subject to the Governor's Red Tape Reduction Act in 2017. We, along with other agencies, were moving forward with reauthorization of rule, in part or largely because of House Bill 316. The health district was essentially kicked out of the rulemaking process last December. Thereby, we lost our opportunity to reauthorize, and thus sought assistance from Kootenai County because the rule is specific to Kootenai County and the aquifer thereof.
Good. Thank you.
And I might add another little piece of this administrative rule is the institutional control program that we have largely in the Silver Valley, Shoshone County, but part of that does connect up with Kootenai County as well. And the Department of Environmental Quality is actively working on having that authority to continue that program. We've attended some of those public meetings and they've been very, very positive up in the Silver Valley. But it's part of Kootenai, a little piece of it as well, so it's moving along nicely. We had a great suicide prevention walk on Saturday. We had 425 people present for that, and a little interesting statistic on that is 70% of those that participated have lost a loved one to suicide. So it is a significant issue. We were happy that we had a Councilwoman Amy Evans. Thank you, Commissioner. Amy Evans was there and repeated the city proclamation that was made last Tuesday on suicide prevention. And of course, we had Governor Little there with us as well, who did a state proclamation associated with suicide prevention. So a wonderful effort. It was a wonderful day, and a lot of great folks came to join us there. On a separate issue, you may have heard that Panhandle Health District is ending, after 55 years, its home health program. And the real reason is finding nurses in that program. You've seen the information coming from Kootenai Health. We are the same. Costs for nurses going up 213% at Kootenai Health. Well, we're the same. We just cannot be a fiscally responsible program with the way those costs have gone up. Gratefully, we also don't want to compete with private industry. There's several home health agencies, and we just made that announcement a week ago, and already 28 of our 35 patients have already been relocated to other home health agencies, and we're working on the last 7. So that was a very difficult decision for us to make, but just due to the inability, years, frankly, trying to find RNs to run that program, to manage that program has been very, very challenging for us. So, but thankfully, looks like all of those patients will find new homes and get good care.
When new patients come to you requesting, you just tell them we don't offer that?
That's correct.
Where do you direct them to?
Well, they come mostly from the hospital, and we just inform the hospital, and they have a pool of home health agencies that they will refer them to.
So they're not without
That's correct.
resources?
Yeah,
Okay.
absolutely. We have a little concern with that. You know, we were going anywhere in the 5 northern counties. Again, this hasn't been a problem in Kootenai County, but, you know, we've had patients within a mile of the Canadian border, for example, that we were traveling to and servicing. And, you know, finding a home for those might be a little challenging, but we're working on that. Wanted to talk a little bit, just to keep you aware, of food fees here. Just a little understanding, there's 7 health districts in the state of Idaho, and each health district has a trustee. And those trustees get together periodically throughout the year. And Glenn Bailey is our Board of Health member, who's the trustee associated with Panhandle Health District. They are coming together and will attempt to bring forth legislation to remove food fees from state statute. Now, we have delegated authority from the Department of Health and Welfare to continue the food inspection program, and we, of course, want to continue that. But it's the fee that's in question. So every health district in the state, it's the same fee for everyone. We have noticed at Panhandle Health District over the last year, we've lost nearly $150,000 between the fee and what the costs are. So the trustees have come together and will attempt to have that fee removed, leaving it up to individual health districts, individual counties really, to determine what those fees are. I don't know what the outcome of that will be. This is going to be an interesting legislative year, without a doubt, with so many new faces. But I wanted just to keep you aware that that is in the process. We're working with Eric here. Eric is actually taking the lead here in the state to notify the food industry that this might happen. But I wanted to I didn't want that to come to you flat-footed, and let you know that you might see that coming down the road. So just an update on that. Again, I don't know what the outcome, that's up to the trustees to move that forward.
So if it does go to each local jurisdiction, I think you'll still have to only charge what the service provides, and so it won't be. I don't think that industry has to worry that it's going to be, outrageous or something.
That's absolutely correct, Commissioner. Okay. Actually, and I might say, as we've been comparing our costs to run the food program compared to other districts, it's lower. It certainly has been.
Okay.
And you're absolutely right. We will, whatever fee we have, it'll only be to cover our costs. Mm-hmm. We can't do more than that, nor do we want to do more than that.
Right.
So we'll kind of see how that transpires going forward.
Okay.
And then the only other item, I know you've had some thoughts about these opioid settlement funds. My goodness, what a large amounts of money that's flowing in on that. And I'm not here to encourage you to allocate those to us or not. That's completely your call. I'm just giving you an update of where we are on that. So we got our funds. The health district gets a percentage. We've had the city of Coeur d'Alene, the city of Hayden, very small amount from them. We've had Bonner County, Boundary County is considering allocating, and also Shoshone County has allocated their funds to the health district. So it's a lot of money that's coming in, very honestly. So what we are intending to do is to hold, if you will, town meetings with our key community partners. So that would be counties, our law enforcement, our schools, healthcare, and ask them how they would like us to use the funds. And it's going to be an effort to make sure that we are using the funds the way they would want to. This isn't an open checkbook for the health district to use them however we wish. Those that have allocated them to us, we're going to them and saying, how would you like to use them? And frankly, assuming that they fall within the deliverables, there are certain criteria, as you so well know, of how those funds should be used. That's how we will use those funds and manage those accordingly. So I just wanted to give you an update.
How soon do you anticipate having town halls?
We hope, Commissioner, to have the decisions of where all that money is going to go within the next 90 days.
Very good.
Yeah.
Mm-hmm. So for us, we have at least 8 departments countywide that use Narcan, and then we have approximately 83 people on average going through detox in the jail every month. And so we're hoping that these opioids will alleviate some taxpayer burden and be able to cover those costs here.
Perfect.
Yeah.
Perfect. That's just how we'd like to see that money getting used, at least whatever support we can give you. That's marvelous to hear, Commissioner. Thanks for
Yeah.
letting us know. And so that does it for my report. Most importantly, I'm here to answer any questions that you might have regarding the Health District.
Go ahead. I really don't.
Okay. Your rules covered 1 septic per 5 acres. Didn't they cover also the business? I don't know the name of the.
It's called critical materials.
Yes, critical
Yes,
materials. You'd think I'd remember that after 4 years in aqua protection. Okay, and then the institutional controls. So where are we at with the critical materials? Is that DEQ as well?
That's moving along, but Eric, go ahead.
Commissioner, what our plan is there, because of the support we've had for that program, is to piecemeal that program back together through interactions with the municipalities. We do have a meeting scheduled with Post Falls. Our plan was to start with, if we can get Post Falls, Coeur d'Alene, and Hayden on board, and then out to Rathdrum, that will actually pick up 70 to 80% of those facilities that we were looking at.
Okay.
So our goal is to have them enact ordinances similar to what the county has done, and then to contract those authorities to the health district for implementation.
Sure, but we did not do the critical materials.
You did not.
Correct.
Okay.
That is correct.
So will you come back to us too then?
I do not believe so, simply because it's my understanding that the county doesn't have reach into the municipalities.
We don't, but we do have businesses in the county area. So would you just try to get voluntary participation then with them?
I'm sorry, you are correct. If we are successful with the municipalities, we will then reach out to the county with similar models and seek your support as well.
Okay, perfect. 'Cause I know I've got one like literally on my eastern border on my house.
Okay.
And they've done great. They're actually kind of pioneers in how they started handling their materials. But that just leads me to believe that there's other locations that have the critical materials need.
Yeah, there's several hundred actually that are over the aquifer. I was surprised when we looked into that to find them. And I will add, I think, and thank you for bringing that up to remind us about this, Commissioner. But that process has largely been, 99% of the time, is educational.
Yep.
Rather than really enforcing a fine or any sort of regulatory pressure on
It was years though. I mean, it was year. I don't know that you still haven't given a fine, but it was at the last I heard, it was 3 years that there were no fines. It was 100% compliance.
That's Commissioner, that's correct.
Okay.
I mean, we can see an issue and then we educate and then we come back and check and then it's corrected or remediated and there is no fine that's given. So
Great.
it's gone well.
Good. All right. Well, I'll look forward to that in a few months and we'll kind of go from there. So
Thanks so much.
you bet. Anything else? No? All right. Anything else from you guys?
We're good. Thank you so much for your time. Really do appreciate
you bet.
it.
All right. Public comment? All right. Hearing none, it is 11:14. Thanks for coming in.
Thanks again.
Thank you.
Meeting adjourned.